Back to the Black Health Lit podcast, where we focus on all things Black health. Today, we have a special guest, Faith Elise from Black Health Explained, who is also a PhD student at Johns Hopkins University. Super excited today to have this conversation with you about Black women studying health equity in academia. So can we start off? You're a student at Johns Hopkins, a PhD student. What are you working on?
Yes. Well, first, thank you so much for having me on the podcast. I really look forward to this conversation as well. As far as what I do now, I'm a PhD student at Johns Hopkins School of Nursing, and my research interest is in exploring how social determinants of health impacts the prevention and self-management of heart health in underserved groups, specifically Black populations. So really looking at how those social factors influence how we engage with healthcare services and manage our heart health, which is especially important since heart disease is the number one killer in our community. So yeah.
Okay. So you mentioned social determinants of health. What is social determinants of health in simple terms?
Yes. So social determinants of health are those social factors. So the conditions in which we live, work, age, worship, those conditions and how they influence our health and our healthcare outcomes. And so the social determinants of health includes 5 different facets. Economic stability. So how can I afford housing, or can I afford nutritious food? Education, access, and quality. What is the highest level of education that I have been able to attain, and what was that quality of education like? Healthcare access and quality. Do I have health insurance coverage? Can I visit a healthcare provider? And then neighborhood and social context. So are there parks in my neighborhood for me to work out at, or is there safe streets for me to walk on? And then that social context too. Do I have family and friends for support, which is so important when it comes to managing our health? What's that community relationship like? And so these 5 different sectors work together to really influence how we manage our health. And they're often our first exposures to health conditions or health management. And so, before you even get to the hospital, what influenced that? What led you to this hospital? Likely these social conditions that I just listed. So really important for us to kind of like change the focus from in the hospital to really examining what's occurring outside of the hospital, which are these social factors.
Yes, that's a great point. So everything that we experience daily is what I'm hearing you say. And those things that we have no choice but to experience. So we all need somewhere to live. We need food and nutrition. We need somewhere to get physical activity or go to the adult playground, as I call it, the gym. And I myself, I'm in a very fortunate position, but I used to live in the suburbs, Polaris area, Dublin area, outside of Columbus, Ohio. And I can't tell you how many gyms there are, how many places there are to get physical activity. But then I moved inner city and there may be one YMCA within like 5-7 miles. And so that's an experience of social determinants of health changing for me by moving to another neighborhood that's predominantly Black. Right. And then you touched on food, which we all know the price of food is it's skyrocketing. And if you can't afford nutritious food, are you saying that impacts your health outcomes and your health experience?
Oh, precisely. Yes. So if you're in your neighborhood and the closest access to food is your corner store, and in your corner store you have chips and other processed food easily accessible, then yes, that's going to impact your health in comparison to if you had that grocery store right down the street, easy for you to access. And so, to your point about how you switch neighborhoods and completely seen that difference in what resources are available, that's our community's lived experiences every day. You can live 5 miles away from a suburban area and have about 20 years less of a life expectancy in comparison to your counterparts, just strictly off of your zip code and where you live. And so it's critical for us to take into account these food deserts and other factors that make up individuals' communities, because it's more than what we do at the individual level to manage our health. If it's a hassle for you to be able to even access nutrition food or access physical activity in settings, it's difficult. And it's really important for us to take into account these neighborhood and social factors. And
absolutely.
I'm happy that after the pandemic, it's been highlighted a little more. It's been a problem.
It's been a problem for a while.
Yes, but it took the pandemic to occur for us to really recognize that these differences, these disparities that we're seeing are largely influenced by where we live.
Absolutely. And more specifically, you touched on it, our zip code.
Yes.
I saw research probably about a year or two ago that said our zip codes will determine your life expectancy. They can almost narrow down and say, if you're in 43219, which is where I live, your life expectancy may be this. But if you're in 43235, which I think is Worthington, you may have 10, 20 more years of life just because of your zip code and the things that are available within that zip code.
Yes. And that's terrible considering the history of, redlining and segregation and how that's influenced where we live. This is structural and intentional behaviors to a certain degree when we're looking at these disparities in the access to resources that are available. So
absolutely,
very, very unfortunate reality of ours. But
it is. And I like that you said that it's structural and it's intentional. These things did not happen by accident, and there have been policies put into place. There's always politics at play, economics at play, and we live in a capitalistic society. So that's a discussion for a whole other day. But thank you for explaining that, what social determinants of health are in simple terms, and kind of talking through some examples. So what are some things that we can do as a community and at the individual level to improve social determinants of health for the Black community?
Yes, that's a great question. So first is awareness. Like, this term social determinants of health is relatively new. It was coined in the last 10 years. However, these different factors that I discussed, like economic stability and education, access, and quality, these have been areas for us to prioritize our focus when we're thinking about health management. But now recently, in the last 10 years, we've came to understanding that these factors collectively work together to influence this. And so awareness is really key right now because it is still relatively new. Individuals don't know what social determinants of health means, let alone how it's impacting their health. And so spreading that awareness at the community and individual level is definitely a great first step. Screening for social determinants of health is next. And so these screenings can be done during patient visits. It can be done in your own area, just taking a look at your neighborhood context and these other factors I listed, and considering what challenges or barriers are now that you are subjected to in light of these social factors. And so at a health system level, when we're looking at patients' informations in the chart, if we see they live in a zip code where it's a food desert area, when we're giving them patient education or advising for them to do certain behaviors to manage their health, taking that into account, because that's often where there's a challenge at when it comes to visiting healthcare providers, is that we ask our patients to do certain things to manage their health, but we don't consider how can they manage their health with that. Do they have access to workout in this area? Do they have the finances to afford these nutritious foods that I'm recommending? And so it's really important for us as clinicians to be cognizant of that and tailor our approach when we're talking to patients, really identify their individual needs, because social determinants of health varies for every person, and it's important for us to recognize that the individuality with that. And then referring individuals to services that can be of support for them. So if you're engaging with a patient that is living in a food desert area and struggling to afford medications or to afford nutritious foods, there's so many programs out here to support individuals. And so making that a priority of your own to connect our patients and everyone to these resources is key and vital if we want to improve our management and health. And then collaborating with community agencies and other programs. There's a lot of great programs and organizations out here doing the work, doing the legwork out here to really improve health in the community. So no need to reinvent the wheel. Partner with these organizations that are trusted members in the community, where the community members feel comfortable with engaging with, and see how we can really close this gap that we're seeing by using collaboration and partnership, leveraging that. And then patient education, as I shared, just educating individuals on how these social factors predispose them to stressors that may influence their health outcomes. And so really having these transparent conversations up front, because it's been a long history that has been in play to implement these problems that we see here. And so it's going to take a while before we see changes on that level. But there's small changes that we can do on the individual level that we can advocate for our patients and individuals to do.
Yeah, great answer, great information. So just to summarize and go back, so screening. Mm-hmm. And screening, I know when we go to the doctor, they ask for a lot of paperwork.
Yes.
They ask you to do a lot of clicks before you get to the doctor. Mm-hmm. Sometimes in their patient portal, sometimes they mail out paperwork, and then you get to the doctor and there's more paperwork, but screening saves lives. So if we say you need to get screened for, chronic conditions like diabetes or cancer screenings, it makes sense that social determinants of health screening is also sort of standard. Mm-hmm. Just like we ask, are you a smoker? Yes. And we take people's blood pressure when they come to the office.
Yes.
And then you hit on something else. Hospital systems, health systems, doctors' offices don't need to reinvent the wheel, but instead partner with community organizations that are already in the community, trusted, usually churches, gyms, community rec centers, places like that. And then advocating for ourselves and making sure that as health professionals, we're in the room having those conversations to advocate for what Black patients and people who have positive screens for social determinants of health.
Mm-hmm. Yes.
Did I hit all three of those?
Yes. If I may add briefly.
Yeah, sure.
The importance of policy advocation too.
Oh, yes.
Yes. So, as I mentioned, it's going to take more than these individual behaviors and these changes to really make an impact. A lot of these challenges are rooted in policy. And so it's really important for us to advocate for changes through policy on a larger level. And so advocating for policies that address social determinants of health, including affordable housing.
Absolutely.
Or initiatives, or improving public transportation so that I can access education easier, or access nutritious foods better. And then just improving access to these healthy food options, as I shared, incorporating more grocery stores and other areas for individuals to engage easier with these services can be accomplished and must be accomplished through the policy level if we really want to see sustained change over time.
Right. That's a challenging one. Mm-hmm. So how does someone get involved or even learn? Because I feel like oftentimes, especially as Black people, or especially if you're Black and you may be economically disadvantaged and you have those two things working against you, how do you even find out about the policy before it's on Instagram or TikTok, after it's done? I feel like we always find out after it's done and then there's an uproar. But before it's done, before the ink is dry on those policies, how do we engage and find out more so we can influence them?
Yes, that's a great question, and something that I'm still learning too in terms of how to best be involved in policy. And so I will say there's a lot of resources out there available, websites where they will inform you about bills and other things that are going on and conversations that are being had, that we're allowed to come into these courtrooms and advocate and share our perspectives. And so again, a little ignorant to exactly how this process goes, but there are opportunities for us to have our voices heard on the policy level. And so actively seeking out how we can share how these policies affect us is key. Because when these individuals are creating these policies, often the community's voice is left out and how it's going to impact us. And so it's really key for us to go down to these settings and advocate and share how these policies can best support us as they're intended to do.
Yeah, housing is a big one, especially in really nationally. Mm-hmm. Housing affordability is a problem. And if you don't have somewhere to live, you're not thinking about, did I take my insulin today? Did I take my vitamins? Did I get my walk in? Mm-hmm. How many steps did I get today? Right. If you don't have somewhere to live. So that one, I'm not an expert in policy either, but City Hall may be a good place to start wherever people are located.
Yes, definitely.
Yeah. So talk to me a little bit about why it's so important for Black women to study and influence and impact health equity, specifically in academia.
Mm-hmm. Yes. So, as you are aware, as a Black woman, we are a marginalized group.
Yes.
And we often have a very unique perspective that's not accounted for. We don't have seats at a lot of tables individuals that can really benefit from our perspective, especially when we consider like the intersectionality and how, not only are we Black, but we're Black women. And those where we have specific and unique challenges that we face in comparison to our counterparts that must be addressed and tailored. And so in academia, it's really important for representation. You only can be what you see. And if there's a lack of representation of Black women in academia, that says a lot about what the future of academia will continue to look like. And so increasing representation of individuals is important for the future. In terms of this health disparity work that we're doing, it's important to have the individuals at the table who are impacted by these challenges and can best understand and relate to the community members that are undergoing this. And so with us being so significantly underrepresented in healthcare, it can be hard to really affect change on a large level and engage these hard to reach groups in research and academia. And so our representation can really make a difference in really bridging that gap and connecting more individuals into the resources. And then just as I shared, like the role model aspect, like that's so big. I am a product of mentorship, a product of mentorship from phenomenal Black women. And I can't say that I would be here right now if it wasn't for those mentors of mine. And so really just putting forth this effort and really recognizing what the lasting impacts of it can be. That's what gets me going when I'm thinking about the role that I'm having in academia. It's sad that we're so underrepresented now, but I'm hopeful and optimistic that my presence here can bring a new generation forward, can be the difference for someone else to be able to be in this spaces. So it's critical for this work to have someone that can understand and connect with these challenges best. And then it's critical just for the advancement that we have more Black women specifically, and who, again, like I said, women, we're just underrepresented in general in terms of academia, but specifically Black women, we're even less represented. So really prioritizing having that voice at the table.
Absolutely. And you made me think when you were talking about the representation and role modeling about the song. I think Whitney Houston sings it, I believe that song. And just if we don't have Black women in academia, then we're cranking out more of the same when these professionals hit the real world and are influencing policy change programs. If Black women are not there in academia, we get more of the same as a product, right, of new talent in the marketplace. Okay. So you ready for some rapid fire questions?
Yes.
To wrap up today's discussion?
Yes.
All right, let's go. What does wellness mean to you?
Yes. So wellness is it's like a culmination of so many different factors. I think often we think of just physical wellness when we think of wellness.
We do.
It's emotional wellness. It's spiritual wellness. It's your overall well-being. And so I think of wellness as just like, how are you balancing all these different facets of yourself, and how is that, working to influence physical and mental health outcomes? And so finding what that optimal health is for you and what that looks like for you, and engaging in healthy habits to support that is wellness for me. And so it's not a cookie cutter response. It's going to look different for all of us, but really taking that time to sit with yourself in all these different facets and recognize what you need to be at optimal health, and then implementing those healthy habits is wellness to me.
Figure it out and then do it.
Yes, do
for
it.
You.
For you, yes. Because what works for someone else may not work for you. And so, yes, really taking that time to really assess your own individual needs and putting some action behind this.
Yeah. So why is Black health literacy important?
Yes. So the last national assessment on health literacy found that Black Americans were among the lowest for health literacy. And health literacy has been shown to be linked to poor health outcomes and just poor health management in general. And so if Black Americans have the lowest health literacy, that says a lot about what we are prone to in terms of our health management. And so it's really important to increase health literacy in our community, especially in light of these social determinants of health factors that are already putting barriers between us even more. And so, So for like health literacy, it's really important that we, through channels like our pages here, use our platforms to spread awareness about these health topics, make it more understandable for everyone so that they can engage with these materials better, and really just educating our community members on what are some things that they can do on an individual level, but on a larger community level to support their health management. So health literacy is critical to, your future health outcomes. And so it's really important that we all do our part in improving health literacy among the Black community, but then other underrepresented groups at large too.
Yeah, for sure. There's a direct connection. Health literacy, health outcomes.
Yes.
Well, thank you so much. You've been great. You shared a lot of great information today, and I wish you the best with getting that PhD. I know you got it on lock. In the meantime, before you become a doctor, how can people learn more about you, and how can people find you?
Yes. So I manage a health promotion page called Black Health Explained, where we share simplified health information through infographics and videos to promote understanding, specifically among the Black community. We tailor our health information towards the Black community. So if you want to connect further, we have a website called blackhealthexplained.com. And then we have our Instagram, which is BHE Explained. And so these are the two platforms that we're on primarily now, and a great way for you to connect with us. And there's a contact form on our website too if you're ever interested in doing collaboration and discussing. We're always more than happy to support and uplift our community members and the voices of students and other healthcare experts too. So always looking for a way to connect our community with the resources they need.
Good. Well, thank you so much.